Welcome, everyone. Do we have a quorum?
Yes.
We do? Excellent. All right. If we want to get started, we'll start with the Pledge of Allegiance. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. If we'll take a moment. We come together today with hearts dedicated to service and minds focused on the well-being of our community. Guide our discussions with wisdom, compassion, and clarity. Help us to make decisions that honor the dignity of every individual and support the most vulnerable among us. Bless the work of our hands and the spirit of collaboration in this room. May our efforts today sow seeds of hope, healing, and justice throughout our county. Amen. Amen. All right, we're going to start with the minutes. Did everyone have a chance to review them? Any questions, concerns? Would we like to make a motion to approve them?
I'll make a motion to approve.
Second. And we have a second. Thank you very much. You're taking minutes, right? Okay. Ashley's taking minutes for us tonight. Somebody? Anybody?
Yes.
Sounds good. All right. Next is the approval of tonight's agenda. Has everyone had a chance to look it over? Do we have a motion?
Motion to approve.
Do we have a second? Second. And so it's passed. Next up is old business. Anything? Start with applications. All right. So at our last meeting, we reviewed 3 applications and made the decision to conduct interviews with them. And Brandy and I just completed the last interview. So we will go over each of them. Let's see. The first application.
In your packets on page 17,
Thank you.
you will be able to see a summary of all of the current board positions, current members, as well as the vacancies and the applicants there. And then behind those are the actual applications for the 3 current applicants. You have 1 community-based organization representative position available to fill, and 2 applicants for that, Jesse Granger and Eric Claflin. You may approve neither of them, or recommend neither of them to move forward to the Board of County Commissioners, or both of them, or just one of them. Either way, the Board of County Commissioners, assuming that you choose to advance any of them for consideration for the board, they will only be able to fill one of those. And then, so I'd recommend you address that first, and then the last application is for the psychologist position, and that is for Matthew Childs.
And I see that we also had a couple come up this month in April. Have we spoken with them?
No, but they will be receiving the ones that are expiring this month.
Yeah, Dr. Bott and Dr. Kolash.
Yes, will be receiving applications to reapply.
Okay. So the first position we had 2 applicants for, and that was Jesse Granger and Eric Claflin. Claflin? Yeah. I like them both.
I know, they are both very great candidates. Both very great candidates, very knowledgeable, opposite ends of community-based organization. I personally liked Eric Claflin being part of the paramedic world. I think of all the diversity on this board from different angles, we don't have that collaborative and things that he talked about, that where the crossover is with county healthcare and paramedic world. I think he would definitely be an asset to collaborate with, to brainstorm on some things.
I know, I'm really torn because I did like them both. I do think that Jessie had a lot to contribute with her focus on the, yeah, and that being a high need in our area. Unfortunately, it wasn't a scenario which I was hoping that maybe she had a parent that was a recipient. That was not the scenario. You know,
I think even with Jessie, just an FYI for everybody on the board who works for the county, she may be someone worth looking out to or reaching out to with some of the Meals on Wheels thing as well as a possible collaboration for some help.
Likewise, where I think he would have interest in the crisis collaborative, you know, and Healthy Union when we talk about it. So I actually think that it should be up to the commissioners.
We'll put it on the.
But does anyone have any questions, thoughts, concerns?
The only thing I'll ask is, when we talked to Jessie, I didn't talk to Eric, but I talked to Jessie, she was saying that they get local government funding as well. Local government would be Union County government. Is that a conflict of interest?
That's the council for,
The Council on Aging does receive funds, but we did verify with legal that that would not be considered a conflict of interest because of her position in that
as a family care,
organization.
yeah, it's
Okay.
not.
I just want to make sure. I didn't know.
Good question.
So her position's over respite and, you know, like the services, caregiver support services and not the financials.
Right.
Yeah, right.
And obviously, if she were on the board and you all were to need to be taking any action, and this would apply to any of y'all, that had to do with an organizational component of something that you were involved with, then you'd have to recuse yourself.
So for clarity, we could put both to the commissioners, or we could make a choice here and put the choice to the commissioners. Is that correct?
That is correct.
Madam Chair, can I make a comment? Be careful, how do I say this correctly? The board struggled with making sure the commissioners understood that you wanted your voices heard during the fluoride issue. Be very careful in saying we're gonna give this back to y'all till you make a decision, because many times of doing that and you won't be consulted. So you can't have it both ways. You can't sit here on one hand and say we want to be heard, we expect to be heard, you have us here for a reason, and then turn around and say, yeah, we really don't want to make this decision, y'all make it. So you riding a fence is going to put splinters in your hind end. So you gotta, you need to make a call, in my opinion.
Adding to that, if you want to advance both of them, you can advance both of them and then say what your recommendation would be, right? If there is a recommendation of one versus the other, which, I mean, either way is obviously perfectly acceptable. But if you don't have concerns with either of them, but you would recommend one over the other, then you can do that, and we'll make sure that we include that information in the language. Or if you would prefer just to go ahead and make your decision, and then we can advance only one of two.
The only thing I would say is that maybe just look at who we already have on the board and what, you know.
That's why
what
the paramedic.
Yeah, like what, like who brings a different viewpoint.
May I make a motion to pass on Mr. Eric Claflin to the Board of County Commissioners for the main reason in being the collaboration of the board? That is one piece that we are missing that I think could be an asset.
I second it.
All those in favor? Any opposition? So it's passed. And the other up tonight would be Dr. Matthew Childs. You see his application on
I will make a motion to pass this to the Board of County Commissioners.
I second it.
I thought he was good.
You did?
Yeah. He seems excited.
My only concern was the political comment.
Did he make a political comment?
No, he didn't make a personal political, he thought of it as politics, like,
Oh, well, I think he just said he likes politics. I mean, he didn't say one way or the other which side. He just said that
right,
he
no, he
liked
did
it.
not
Yeah.
overstep, I'm not saying that,
Yeah. That didn't bother me.
Okay. All right, so, all those in favor?
Aye.
Aye. Any opposition? All right. Okay, so both, Dr. Childs and I think he's Dr. Placement too, isn't he?
Oh, cool. Yeah.
Yeah, will be sent to the county commissioners. I'm sorry. And then next up is the executive director's report.
Excellent. So this evening, I would like to review with you all the Consolidated Human Services Board Rules of Procedure and Policies. And if you turn to page 27 in your packets, you will see there are actually 6 different documents that we're going to go over. Only one of them has any adjustments to it, and that is the Rules of Procedure, which is what governs all of our meetings. And then the others, we just need you to briefly review and approve all of them to continue on as they are, or if you all have any changes that you would like to propose making, then obviously your rules of procedure, so you are welcome to do that. On page, so starting with the Union County Consolidated Human Services Board Rules of Procedure document, which begins on page 27. There are adjustments on page 30, technical corrections in that section, adjusting the number of positions in the composition of the board from 18 to 19. That should have been made last year when we had completed this review at the same time, and it was not included. And the reason for that adjustment is because the Board of County Commissioners had previously taken action to adjust the number of other person positions from 2 to 3. And so that's the first component.
When was that action?
When was that action that the Board of County Commissioners took? May I have a moment to find it?
Don't derail for it.
Okay, I will come
Yeah.
back to you on that. I think that it was, let me come back to you.
Yeah, you can come back.
I'll tell you a story. And then on page 33, there is an addition that that staff would like to recommend, and that is to include a component about meeting cancellations. So currently, we have had the ability to cancel, but there wasn't anything in the rules that spoke to how that actually happens. Obviously, we have to follow all laws pertaining to public meeting bodies, so if there is a cancellation, then we'll post that appropriately, provide proper notice and all of that. But what wasn't included that we would recommend including is why that might occur, and who might be able to make that decision, just so that it's clear to me and to you all always. And what we have written here, you all can see, but I'll read out loud for you, is meeting cancellations. The chair and or the director may cancel the regularly scheduled meeting. Examples of why a meeting would be canceled could be lack of quorum, lack of new agenda items, regularly scheduled meeting date falling on a holiday, inclement weather, or some other emergency requiring cancellation or overlapping with, I'm sorry y'all, this is not the one that I'm supposed to have. And I just realized as I was reading it out loud, and I apologize, I'm not sure this one was printed. If you'll give me just a second. And Jackie, if you wouldn't mind. out the one that was supposed to be, just so that, just do that. So it just has, it has
Proposed
slightly
is not
different.
what's on the screen.
No, it's not, and what we're proposing has just slightly different language, and I apologize, it takes out the and or.
Well, look what's coming up. Yeah. Or not the ones that are coming up. That's not the ones that we could remove. The ones that are coming up, we need to stay.
Oh, right. No, you know, like, we probably could do like one less other person, one less consumer.
That's what they just expanded this other.
No, I don't know.
And we just.
Oh, yeah.
She's working.
Maybe they'll clean my spot.
So Jackie will bring this
You still
back,
have another year.
but it should read, meeting cancellations, the chair or the, not and or, but or the director may cancel a regular meeting if that regular meeting is not the only regular meeting scheduled for that quarter. So part of the reason for that is by state statute, we have to have at least, this board, pardon me, has to have at least one meeting per quarter throughout the year.
So that was the add-on, if it's not the only meeting of the quarter?
Well, so the and or, she's gonna print them out so you can see the exact language, but we changed the and or component. All of this is new language. So it was just adjusted slightly to be completely clear, because and or is not clear. It has to be one or the other. So what you will see when she brings it back to you is the chair or the director may cancel a regular meeting if that regular meeting is not the only regular meeting scheduled for that quarter. Reasons why a regular meeting may be canceled include, but are not limited to, lack of a quorum, lack of new agenda items, regularly scheduled meeting date falling on a holiday, inclement weather, or some other emergency requiring cancellation. This list of examples is not exhaustive, and cancellation is in the discretion of the chair or the director.
What about if there's something pressing on the agenda? I mean, we've had things before that we've needed to do for y'all to.
Right, so if there's something pressing, we can't, do you mean if there was something pressing and we had a quorum?
I mean, it's fine.
If we don't have a quorum, we have to reschedule.
Yeah, we have, we don't
Yeah.
have a choice.
Next regular meeting.
I mean, if we don't have a quorum, we don't have a quorum. You know, like. I
Yes,
guess-
if we don't have a quorum, we don't have a quorum. So if we knew that ahead of time, which has typically been the reason in the past why we would have canceled.
And lack of agenda is the other.
Or lack of agenda
Yeah, that's the
items is
only
the
ones I've
only other
seen,
reason.
yeah.
So if there was something pressing, we would do our best to encourage you all to be present and come for the meeting.
And it says it's not exhaustive.
Correct. Yeah, I did, but I don't know that it's printing for some reason. I'm so sorry.
Sorry, I'm okay with it.
Can we just read it from the top?
Yes, we may. Meeting cancellations. The chair or the director may cancel a regular meeting if that regular meeting is not the only regular meeting scheduled for that quarter. Reasons why a regular meeting may be canceled include, but are not limited to, lack of quorum, lack of new agenda items, regularly scheduled meeting date falling on a holiday, inclement weather, or some other emergency requiring cancellation. This list of examples is not exhaustive, and cancellation is in the discretion of the chair or the director.
And so that's what we're gonna vote on.
Both of those changes, and I'm gonna see if I can email this to our team.
Both being in section 12, what was there?
The change that was also changing 18 to 19 and 2 to 3 other persons.
That's right.
And I just emailed Richard and Nicole in case you're able to see that, if you happen to be able to pull that up.
Yep.
Excellent, thank you. That way you all can see what is written. Oh, and they printed, that's lovely. So, there we go. Excellent. Thank you all for your patience, and I apologize for that oversight.
Thank you.
Thank you.
Do we have to approve each change individually, or can we approve
No,
all
you
of
can
them?
approve the entire thing,
Okay.
but mainly just if there are any
Yes.
adjustments that you would want to have made.
So first, are there any discussions, questions on the changes of section 12? Are there any questions or concerns on the changes to 3 other, putting the board at 19?
You will?
Thank you,
Are there
Richard.
any? Or anyone proposing?
I'll make a motion to approve. Is that what we-
I second.
All those in favor?
Aye.
Any opposition? And it passed.
Excellent, thank you all. All right, so the next 5 documents are the policies that are in effect that you all have adopted in the past. There are no changes to any of these, but I just want to run through each of them briefly to make sure that you are comfortable. And if it's okay with you all, maybe we'll go through and then you can just do one motion for all of them unless there's anything that is needed. So the first one is the policy development policy, which is a very appropriate name and oddly necessary. Required from an accreditation perspective that we actually have a framework for how you all develop policies. And so that literally is what this is. It basically states that anything that requires guidance by the Human Services Board must be in written form and must be in the form of a policy. And that's literally what this describes, is that process. Any questions about that? Hearing none, I will move on, and feel free to pause me and have me come back. The next policy is the rules adoption policy, and that is for the purpose of if this board is going to enact any regulations as a board, then those regulations have to be related to the promotion or protection of health, reasonable in light of the health-related risk, health risk addressed, that they may not be in violation of any law or constitutional provision, they may not be discriminatory, and they may not make distinctions based upon policy concerns traditionally reserved for legislative bodies. Questions on that? None. The third,
Wait,
yes,
I have
ma'am.
one question. Can you just elaborate on number 2? Because this is saying as the board member, right? Are reasonable in light of the health risk addressed. Define that a little bit. Explain that a little
So
bit.
I will do my best, and if anyone else, anyone of my teammates in the room would like to jump in, please do. But effectively, if you all, so obviously we've had discussions in the past and about where policies might be enacted by the Human Services Board, and those typically are in association with something that would impact the health of the community, right? And so if you were going to implement any sort of regulation or recommend that a regulation be implemented, then that would have to be, the action that you all would be recommending to implement would need to be considered reasonable, effectively. So if you were, I'm trying to think of an example of something that might not be, but let's just say that you were thirsty, right? This is not going to be a health regulation, but let's say that you as an individual were thirsty and that this board wanted to take action to solve that thirst. If you wanted to put in place a new water tank just for your thirst, that might not be reasonable because a bottle of water might be sufficient to solve your thirst for that period of time, which is obviously not a specific example associated with the health risk involved, but
2 questions.
yes, sure.
Who determines reasonable? Do we collaborate as a board to say, who says that's not a reasonable thing, Brandy? Or if I
You
want
would,
to tank.
you would collaborate as a board, and then if there were an action taken that were not reasonable, I believe that the Board of County Commissioners would have the opportunity, as well as any member of the public or the legislative body would have an opportunity to respond to that and say this is not reasonable, and then some subsequent action would be taken at that point.
So if we voted on something, the final vote is the county commissioners.
If it requires funding.
It depends on what the vote is in regard to.
Okay.
So the training, and we can bring that training back that the School of Government provided last September and August about what types of things this board could put in place versus. So I'll give an example of something where actually this would go to the Board of County Commissioners, but it certainly starts with you all. Fees are something, and so that's something that we'll actually bring fees to you at next month's meeting, and we will need a quorum at next month's meeting. And so I'd love to go ahead and say that if we can have a quorum next month in May, that would be ideal. But fees, so our staff will recommend fees to you all. You all could vote to make a change to those fees, and that change that you vote to make may or may not be deemed reasonable. And when that then is taken to the Board of County Commissioners, they would be able to take action that would be in regard to whether or not that was reasonable and make adjustments.
So they determine?
Another example.
So I can give you an example of a public health ordinance that we do not have, but we may consider in the future. That would be a mosquito control ordinance to eliminate standing water on properties that can become a vector harborage, those types of things, especially with the seasonal changes we're having. Speaking from environmental health, we receive a number of complaints every summer, particularly with properties that aren't properly maintained. So that is something that the board can look at from maybe even just in a complaint enforcement process. I will tell you a public health ordinance is typically enforceable across municipal boundaries. A county ordinance, alternatively, is enforceable in unincorporated Union County or municipalities that adopt the ordinance by reference. And so, we have an example of that. An ordinance that may not have, may be wanted by the public, but may not have good public health reasoning behind it, would be something that we field complaints on all the time, which was the grass is too high. They're not cutting their grass. The mosquitoes are bad, or the insects are bad. That's an example of an ordinance that, may be more of a zoning related, but not public health related, if that makes sense.
Tracy, what did you say was the one that it automatically goes to unincorporated, but
So there are county ordinances where they're actually enforced by the Board of County Commissioners. Those are enforceable in unincorporated Union County or municipalities that adopt them by reference. And then there are public health ordinances that are applicable across the county regardless of municipality.
your question?
Thank you.
Next.
Thank you for the question, Mary. The next policy is the staff development, training, and education policy. And this basically covers the fact that in order to ensure that we have staff members who are prepared to do their jobs and provide service to the community that is effective, that we will, that is the responsibility of each employee and of us as the leaders of those employees to ensure that they're able to obtain the necessary continuing education hours as required by the position, and that we have to maintain a comprehensive training and education program because things are changing all the time, especially within health. And the purpose, as written here, is to provide necessary training and education for staff members to enable them to fulfill the responsibilities of their positions, to increase knowledge and technical skills of staff members, to increase staff member competency in specific area of practice, to provide staff members with current healthcare information, to promote an environment conducive to the acknowledgement and acceptance of innovative ideas and programs by staff members, and to promote staff retention through the provision of training and educational requirements. And there are a number of different components that are listed throughout the process, but that starts with the orientation. We have annual training that occurs literally annually. It's actually starting next week. And we have continuing education that is ongoing, and that varies by position or person based on their positions. And then in-service education also would be the same, as well as incidental learning and patient education, just to make sure that we're able to provide our patients and clients with the information that they need. Any questions about that one? Excellent. And the last policy is an appeals policy. And this indicates that it is the board's policy to adhere to the applicable appeals procedures as written in General Statute 130A-24, sections B, C, D, and E. And I can read those for you if you would like. And the reason for this is to simply establish the methods and guidelines for adjudication that you all would follow. Effectively, if you all set a rule and there were an appeal to any decision that were made in association with that rule, or if there was an imposition of an administrative penalty by public health, which Tracy just gave an example of local ordinance that would potentially have an administrative penalty associated with it. If the resident who was impacted by that rule or by that administrative penalty took issue with that, then this is the process that they would follow. Effectively, the aggrieved person would have 30 days to file an appeal with the health director. They would file that appeal, and then the health director would provide notice within 5 days to you all as the board of the appeal and anything associated with that. And then you all would have to hold a hearing within 15 days of the receipt of the notice of appeal, and then provide a response back to that person within 10 days after that hearing. So basically just this ensures that the public has a remedy should something occur that they are aggrieved with. Oh, sorry. Any questions on that one? And the last one is public participation for community health improvement and strategic plan. And so the purpose of this one is to assure that we obtain community input and public participation in the development of goals, objectives, and strategies for the community health assessment, and that those inputs are utilized to develop our annual strategic plan. And so as Stephanie Starr mentioned, I believe at the last meeting, we are currently in the process of completing this. We complete a community health assessment once every 3 years. We were required to do it once every 4, but we adjusted our process so that we could do that in conjunction with the local hospital systems because they're required to do it every 3 years. And so we partner with Atrium and Novant to make that happen. And then in the interim years, we complete what's called the State of the County Health Report, which is otherwise known as SOCH report, and that is updated to indicate the progress that we as an organization and the community actually have been making towards those goals that were identified through the community health assessment and the subsequent strategic plan.
So
what are the actual changes on this?
There are no changes on any of these, policies. We just need you all to review them annually, because in the first one, that is the policy-making policy, it says that we will review these annually.
Okay. And a question on this, Stephanie's not here tonight. Do you know if we've had any increased participation in this past month? I mean, it's very low. It's not for lack of effort.
I do
You know,
know that we have had some increased participation,
It's
and
people are tired of doing surveys kind of thing, maybe.
700 and change
yeah.
the last
that-
time.
Oh,
so
that's
about
almost
a
double.
week ago,
That's-
there were 700, yeah.
But that's still a fraction of what we're going for, but that's like a 300 increase in a month.
It is, which is positive, and we have 2
So-
more weeks.
Yeah. Could we send that to everyone on the board?
Absolutely.
I think that it would be reasonable for everybody to take the moment to look at that and answer it, share it.
Yes, 100%. In fact, before we leave this evening, we'll give you the handouts that are in
Thank you.
Spanish and English, and then we'll send that to you electronically as well. So what we need before we move on is consideration from you all to make a motion to approve, since you have reviewed all of these policies, to approve all of the policies.
I make a motion to approve.
I'll second it.
All those in favor?
Aye.
Anyone opposed?
Thank you all.
So where did we end up with the informational update on?
So we have one more agenda item, and that is the informational update on tuberculosis and measles. And our health director and nursing director, Ashley Burks, actually is going to lead this one.
And then I have a relevant question for this one.
Megan Troll, our CD lead nurse, actually put the slides together. The first two are just our statistics for TB, both last year and this year, just kind of a comparison. 2024, we had 12 active cases all year long, and thank you. And then this year, we have had 8 total. Some of them were carryovers being treated from last year, just 1 new case. I think the biggest difference is that in 2024, we had 339 contacts, which is a lot of legwork for the nurses to investigate and contact all those folks. This year, we haven't had any new contacts to do, so that is helpful. Any questions about the TB comparison?
What's the difference between like right now and last year in terms of the numbers? Like you had more contacts last year.
Right, just because of who those cases were, a high school student who had, was
So that means you have the contact
during the
policy.
time, was in school and worked, versus the new case that we have this year, it's extrapulmonary, so there's tuberculosis in some other body system, so it's not infectious respiratory, so.
Thank you.
Measles outbreak update. As of April 10th, 712 cases have been reported in the states. Tennessee and Georgia are the states closest to us that do have positive cases. We think that the number is much higher than what's being reported. That is really based on the number of deaths that we've had. Usually you see about a death per 1,000 cases, and you can see kind of the discrepancy there. You can see on the slide, most of the people that have been infected are not vaccinated. Only 11% have been hospitalized, mostly children that are young. 2 of the 3 deaths were attributed to measles, and the other one is still under investigation.
Can I just ask for clarification? So 712 cases, of those 712, 97% unvaccinated, 11% of those 712 were hospitalized. That 11% is age 5 and under?
Not necessarily.
Okay.
Just
No, just
most
most.
of that
Okay.
11% were kids.
And then the 2 deaths, does the 2 include the 1 death in Texas?
I can't remember which.
Okay.
places
And
were.
then 2 deaths, do we know if that's both children or could be an adult too?
2 of them were children,
So the 2 deaths are children.
but I don't know which
think all
the
3
confirmed, which the confirmed is.
And you don't know if it includes the Texas? It probably does, but okay.
Were all 3 not children? Is one of them adult?
Maybe, I was thinking that one was an adult, but I'm not positive. I know at least 2 children. Then here in Union County, there's no measles in Union County or Monroe or North Carolina. Thank goodness, knock on wood. I know we're talking a lot about it. The CD, North Carolina Communicable Disease Branch has hosted webinars. CDC's hosted webinars. We've broadly spread, those links to school nurses and providers so that everybody can really get up to speed and get more familiar with what they need to be looking at or looking for. We are working with environmental health and our child health care consultants, putting together information that will target those specific groups, just to educate them, to help them be better aware. One of our, Megan is going to be attending an event in Mecklenburg County at the end of the month. They're doing like a tabletop and exercise for a measles event, so she's going to be participating in that. And we are planning to have not our whole epi team, but a mini epi team kind of meet before and after that, just to kind of walk through what that would look like here. So lots of groundwork, making sure we've got plenty of vaccine, and hoping that we don't need to use it. And that is it. And there's one more slide on there that's got resources.
Yeah, I just one question about the 97%. I asked about it last week, about the unvaccinated cases. I believe that's unvaccinated or unknown. Is that true?
It probably
That
is,
also
yeah.
includes
Because
unknown
we can only count the ones that we know, so.
Okay. So, so that's including, we don't know if there's a whole bunch that are, I don't even know how many are unknown, but.
Right. Either unknown, or it could even be under-vaccinated, where they got one, but they didn't get the second one.
But even that's supposed to be, what was it, like 90
It's 90,
versus?
95% effective with just one dose.
Ashley, let me ask you a question, because you just said making sure enough vaccines are on hand. What's the policy? Because there's a lot of controversy coming out of the one in Texas. CDC says if a child has suspected measles, you don't give the measles vaccine at that point. What's y'all's policy here at the health department? Do you follow that?
Right. If we think that the child has measles, they're not going to get the vaccine then.
Okay.
But their contacts, we want to get them vaccinated within several days if we can, because that's been shown to decrease the risk of actually contracting it.
Do you guys do titers at the health department for like the older generations? You do?
Yes. Yep. If there are any
Is that
people that think, oh, I think I had one, I don't know if I had the second one, I'd really like to know I'm protected, yes, we do titers here.
Sliding scale, or
For titers is not a sliding scale.
do you know what the cost is by chance?
I can look it up.
No worries. So I had a question on this, and this is not a county thing, but we've discussed our vaccination rate and, different views of that. And I track House bills, Senate bills. I don't know, it's kind of my thing. But mainly with as they apply to school. But this one popped up, and it was just of interest. I'm not speaking for or against this, but think it might be something that you would want to read. And that is House Bill 803 on immunization requirements. The proposed changes are prohibiting North Carolina from requiring new childhood immunizations until they've been FDA approved for at least 3 years or recommended by both the North Carolina Medical Society and the North Carolina Pediatric Society, which is worth reading up on if you think that would ever happen. So again, I'm not speaking for or against it, but as a county who leads the way, if that is of interest to you, I think reading that bill, and there are a couple of others similar, would be worth. Now, whether that would have any impact here, again, that's state, not county. Just thought it of noteworthy.
I have a question. Does that, that bill, I wonder, does that include emergency use authorization, or when you say FDA approved, you mean the normal approval process?
I think it's just the normal approval process,
so
but
EUA drugs,
yeah,
like
like
Covax would not be included?
I don't know. I mean,
Yeah.
you know,
Okay.
the only reason it even popped on mine is because that would, you know, of the kindergarten vaccination requirement. You know what I mean? Because I was only track school bills,
Yeah.
you know, and mental health bills. But that one popped up. I didn't even go back yet and look if there are other public health bills. You know, this past Thursday was the deadline, so 900 and something filed that day. Hadn't had a chance to read them.
Mm-hmm.
You know, like that one popped up for me. You know, like.
And there are a number of public health bills out there right now. They're not always filed as public health bills. Sometimes they're filed in other ways, sometimes through development, construction. So you can't always find them just through the identification as a public health bill.
Yes. There are other ones that were of interest. For example, there are ones, just again, you know, my view was from schools, but there are ones that address breakfast and lunch in schools. That would be really relevant right now, you know, with funding changes, especially in our county. 807 specifically does that. House bill also. Let's see what else. There was. I would encourage you to check it out. There's a little list and see if anything's of interest. Happy to link anybody.
Measles titer would cost $68.
Thank you. Any other questions, contributions? Anything else? Any updates?
To the question that you posed earlier.
Thank you.
So when the Human Services Board was reestablished in November of 2014, it started with 17 positions. And then in January 4th, 2016, the Board of County Commissioners voted to increase the board by 1 position, adding a community-based organization representative. And then at the end of 2016, December 5th of 2016, the board voted to increase by 1 additional position to add the other person. And so that, again, in those rules should have been adjusted and just was overlooked.
And next month we would find out if either of the Aprils declined to come up in April. You're notified.
Yes, sorry, yes. And if they don't reapply, if they reapply, then they would need to come before you all just to say, yes, we want to advance them back to the Board of County Commissioners. Typically, those would not require a re-interview, but they will apply to Lynn West, to the clerk to the board, and she'll submit those to us, and we'll know whether that occurs or not. And they actually can come and continue to participate because technically they're filling that position until it's posted and able to be filled. So, but yes, we will know if they choose to reapply and make any recommendations as appropriate at that point. And the other 2 things I wanted to share with you are first that last month we talked about several different entities in association with senior nutrition. One of those was Food for Families, and so Stephanie Starr and Emily Colson and one or two of our other team members actually had the opportunity to meet with them on March 21st, and we are very hopeful that we are going to be able to have positive collaboration with them, potentially addressing some of the need to serve seniors on the wait list with a delivery on some frequency. And so that's not a given yet, but they are inclined to make that happen, and so we're going to work with them to try to figure out how can we address that, which would be fabulous. At a minimum, we're having a good collaborative conversation and are going to be able to do something to at least engage those families a little bit better. And then the other thing, also in association with senior nutrition, is that the wait list calls that we've been discussing are underway and going very well, and we should hopefully have those finished within the next 2 weeks. And we have letters out for a couple of people, so we send letters and give 2 weeks for them to respond, and then we're also making phone calls trying to be more proactive to make sure before we take people off the list. But if we've sent a letter to the home and there is no response, and we've made phone contact and either there is no response or obviously they say that they need to be taken off for whatever reason, then I think it's reasonable for us to go ahead and remove them from the waiting list. And so the last time that we looked at that, the waiting list was down, which was about 10 days ago, was down to 520 people, which is not low, but it is less. And so I think Emily and Stephanie had mentioned previously that, pardon me, that we receive about 30 or so new applicants every month, about 25, maybe 35 of those, about 25 of which are actually vetted and able to come on the list. And so it will continue to grow, but this at least is able to make it so that it is hopefully more accurate. And that is all that I had at this point. Ms. Lance for DSS.
I just have really exciting news, and it's the same exciting news I had last month. We are still holding strong at a 5% vacancy rate. I did the math today, and even my social worker brain did the math twice to make sure it was right. And it was actually 4.9%. And we have interviews scheduled next week. So next month, I will be excited to tell you an even better number. So that's all I have right now. Oh, I guess I don't need to pass it all the way. That'll take forever. Jackie?
I don't have any additional updates, thanks.
I don't have anything. Yay.
We do have. So we do have a rabies clinic Saturday. So if you or anybody you know has a pet, not person, that needs to get their yearly or their booster, we'll be here from 9 to 1 in the back parking lot. It's a drive-through. You don't get out. You just stay in your car. There's going to be environmental health is giving away larvicides. So if you've got mosquito issues, you can come pick up that for free. Usually we have some Narcan available for pet owners to have on hand, all kinds of fun stuff. So come on by.
If no one else has anything, then we will.
Motion to adjourn. Second. I mean, no, I don't get to make a motion.
Yeah.
I appreciate the enthusiasm.
All those in favor?
You sounded like you were.
Thank you.
I was just making sure that we actually took action.
That's what I was trying to cue 'em.